very much. I want to just talk briefly about, again, why we are here tonight. And again, it is to have an open, interactive dialogue. We don't want our panelists to just get up and talk for the next hour. We want to make sure that we answer your questions. I also want to mention that as an anchor from WIS-TV, and certainly we have no interest here in pushing political agendas tonight. It really is about making sure that the community is informed. So without further ado, let me make sure that I introduce our panelists. Again, I will keep the introductions brief so that we can focus on the information that we're here to receive tonight. Our first panelist, Rosalind Goodwin, is a director of policy research, also works as a lobbyist for the South Carolina Hospital Association. Prior to joining SCHA, Ms. Goodwin worked in strategic planning and system development with Palmetto Health and in health and human services policy research in the office of former governor, South Carolina governor, that is Jim Hodges. She is a native of Mount Carmel, South Carolina, also holds a bachelor's degree in healthcare management from Lander University and a Master of Health Administration from the University of South Carolina, and is a fellow in the American College of Healthcare Executives. We are also pleased to have with us tonight Commissioner Anthony Peck, the Director of Health and Human Services for Governor Nikki Haley. He holds a Bachelor's of Industrial Engineering and a Master's of Public Health from the University of Michigan, and is currently completing his doctoral thesis in Health Systems Management at Tulane University, focusing on physician workforce issues. He has more than 23 years of experience in healthcare management consulting and policy, and prior to his appointment here in South Carolina, he served in the administration of Louisiana Governor Bobby Jindal as Health and Social Services Policy Advisor to the Governor, and also Chief of Staff and Deputy Secretary of the Louisiana Department of Health and Hospitals. Our third panelist this evening, Representative Joseph Neal, is a Democratic member of the South Carolina House of Representatives, representing District 70. Representative Neal earned his BA from Benedict College in 1972, then attended postgraduate studies at Colgate Divinity Pittsburgh Theological Seminary. He is a pastor at Calvary Baptist Church. He joined the South Carolina State House of Representatives in 1993 and has served in that position since, representing the 70th District. He currently serves as Deputy Democratic Leader and also serves on a number of committees and subcommittees in the House. And last but not least, we are delighted to have Robert Greenwald here with us. He has more than 20 years of experience in the fields of health, public health, and HIV law and policy. He is a professor of law and director of the Center for Health Law and Policy Innovation at Harvard Law School. He and his staff have engaged in state and national research, policy development, and advocacy on health law and policy initiatives. In addition to his responsibilities at Harvard Law School, Attorney Greenwald is currently serving as the director of the Treatment Access Expansion Project as co-chair of the HIV Healthcare Access Working Group and as a member of the Presidential Advisory Council on HIV and AIDS. Let's give all of our panelists a warm welcome.